Predicting heart failure. Kind of interesting is that congestive heart failure is now becoming the leading cause of hospitalization as we get older in life. And I'm thinking that most Canadians, if we live long enough, will develop congestive heart failure, something called diastolic heart failure. We're going to talk a little bit about that. Is that what are the steps that you can do so that your heart pumps better, more efficiently, and lasts you a lifetime without causing you grief? Next slide, please. So this is a tremendous family, and we lost one of our patients recently. She was a wonderful lady, wonderful family, um, but she suffers from congestive heart failure, and she has something called diastolic congestive heart failure, where the heart still has a normal amount of blood that's ejected each time it contracts, but it does it at a higher pressure. It has some scarring in the heart, some fibrosis, uh, and that unfortunately leads to fluid backup. You can see in her legs. She was well looked after by her family. She also had other medical problems. She went into kidney failure over time, and she was offered dialysis. But to be honest with you, dialysis would not extend her life to a very long period of time. Her quality of life wasn't that good. She couldn't really move that well. And also, she had a roller coaster ride. At times, she got better, then got worse. But every time she got worse, would never totally bounce back. And this is what congestive heart failure does. It surprises everybody. Um, I've been feeling so good. And one of the things is that the burden of what your blood pressure is, how much you weigh over a lifetime, how active you are, what's happening to your kidneys. Do I have sugar diabetes? Do I have uh, an irregular heartbeat called atrial fibrillation? These are things that show us that you are developing congestive heart failure. I'm going to miss her tremendously. I'm going to miss her laugh. What a nice lady. And at times people that offered her care in the hope that it would help her, such as fixing her aortic valve or trying to fix her kidneys with dialysis, but it wouldn't lead to any meaningful um, good outcome for her. And family looked after her, and I just don't want this to happen to too many people. So great family, great lady. She's now in a better place, and she fought for a number of years. Uh, Thank you. Next slide, please.
Mhm. Thank you, Dr. Kearney, for sharing that story. And I think it's just a reminder for all of us that a lot of our role in being able to prevent heart failure is kind of up to us in terms of the lifestyle choices that we make and the decisions that we make in terms of exercise and diet. A lot of heart failure can occur before you actually notice the first symptom. We know heart failure as kind of like an insidious disease in that sense. So it's really up to you to be always maintaining and always managing your lifestyle in a way that it can lead to better outcome and prevent heart failure. So throughout the presentation, you might see this button here. This is the Act Now button. And whenever you see the Act Now button, I think all of us here at the clinic want to challenge you to kind of uh, listen to the actionable item that's on the slide and challenge yourself to really go for it and really press that button in a sense to really commit to whether it's like an exercise plan or filling out a questionnaire. Uh, it's something that you should be doing in order to track and monitor your health and improve outcome for heart failure. So, throughout the presentation today, we're going to be talking about congestive heart failure, and our goal today is really to explain to you how to prevent heart failure from onsetting and how to prevent your heart failure from worsening. And if you need some primer or some context on heart failure, we do have a lot of content on our YouTube channel. So, on the Greg Kearney YouTube channel, we have this amazing CHF YouTube series with a lot of information. And we also have a lot of pre recorded webinars that were from the past. So, some of our previous topics included what is congestive heart failure, types of heart failure, medication treatment and management, and lifestyle changes for CHF management. And we'll be touching on all of these a little bit today as well.
So I love this. If you back up one slide, Frank, you see a happy couple. They've aged really well, and you can see number one is that they're active, they're skinny, and their risk factors such as blood pressure and cholesterol controls. They didn't have a heart attack. They kept their cholesterol down. They really looked after themselves well. Unfortunately, if you just back up one more slide, we have all these webinars that deal with a condition called congestive heart failure, and the clock is ticking. Once you make the diagnosis of congestive heart failure, unfortunately, 50% of people will likely pass away within the next 5 years or so. So this is a very serious condition, and I see too often, well, I'll look at those webinars next time. Why do I have to measure my blood pressure? Why do I have to be attentive to my weight? I hope you walk away from here a little bit scared, but also more motivated to become unscared and to make some changes. So points that you need to know what your blood pressure is on a regular basis. It's the burden of blood pressure over a lifetime. You need to know how much you weigh and what's your body mass index. And you have some choices. Do you choose to, next slide please, to age healthy, or do you choose to spend the last years in illness? And lots you can do about this. So even when you're ill, there's so many steps you can do to get healthier. Next slide, please.
Yeah,
Go ahead.
and to just transition off of that, a really great way you can kind of monitor your health and make sure that you are staying healthy and being healthy is through this questionnaire that we have. So we actually have this calculator that's on Google Sheets. So if you're in the webinar watching on YouTube, you can look in the description of the YouTube and you can see a link to this Google Sheet and you should be able to access it. If you're watching on WebEx right now, if Stuart, you could maybe help me paste the link in the chat. That would be great. That's another way for people to access that as well. But essentially, it's just this document over here where you can fill out a questionnaire that asks you a whole bunch of different questions about your symptoms, any limitations that you have, and the quality of life that you have if you have heart failure or if you're looking to kind of prevent heart failure. So we'll be going through this in detail a little bit later, and we'll be filling it out with you. But for now, if you just want to open the link and you want to kind of take a look at the questionnaire, take a look at how everything works, that would be awesome. And we'll be filling this out throughout the presentation with you.
So
So,
basically what I'm saying to you is open it, download, and start filling it out. So if you're short of breath, fill out the questionnaire. If you're not short of breath or the age of 60, fill out the questionnaire. If you've had a heart attack, you have atrial fibrillation, you have diabetes, fill out the questionnaire. So these are things that are important because you're going to get a score between 0 and 100. Go ahead.
yeah, so if you want to fill out the questionnaire, a really great way you can do it is you can either go here to File and you can press Download and you can download it as an Excel. And then Excel just allows you to work on it on your own machine. Or what you can do is if you do have a Google account, you can go here, press File, and press Make a Copy. And let's say we can do, you can name it with your name and save it to your own personal drive. So right now here, what we have is a copy that's available to everyone. And of course, we don't want everybody to be working on a copy that's available to everyone. So you can make it a local copy for yourself on your own computer and waiting for it to load. And there it is. And you can see a copy that you can work on by yourself on yourself. You can use this template here to essentially you can duplicate this template every time. I recommend not changing the template. And what you can do is every time, let's say, you can rename it to a specific date that you're filling this out. So August 13th today, and you can fill it out like this. Just in each cell here, you can put a 1 or a 0, and you can calculate your questionnaire, and you can calculate your overall score here in that kind of way. All right.
And if your computer's silly like myself, we can actually give you the questionnaire and we can fill it out later too as well. So we'll have multiple ways of doing this here. So I'm encouraging everybody to fill out this something called the Kansas City Questionnaire, the short form we'll talk about, and I'll explain why. Because it's probably the best predictor of congestive heart failure and how you're going to do.
All right, so this next thing we're going to talk about here is what specifically is CHF progression or congestive heart failure progression, and casual agents, complications, dangers, and risks that may arise as a result of congestive heart failure progression. Next slide, please. So what specifically is congestive heart failure? So congestive heart failure is a condition where the heart is unable to pump enough blood to meet the body's oxygen and metabolic needs. So as a result of this, the heart begins to pump at a higher pressure to accommodate for the decreased pumping ability. Over time, this condition worsens though to the point where you have fluid beginning to accumulate around the heart, lungs, liver, and other organs and areas of the body. So with congestive heart failure, the heart will undergo changes in its structure, which results in changes in function. And as a result of it, and this happens as a result of it trying to compensate for the decrease in pumping ability. So the heart first responds by enlarging or stretching, increasing in muscle mass, and pumping faster. And unfortunately, because of this, in the long run, this becomes much more detrimental. And these changes result in a weak and thinned heart muscle, a decrease in elasticity and volume, and more strain on the heart. Now, all this and more, including symptoms, causes, testing, treatment stages, and more, were covered in greater detail in previous webinars and videos, like mentioned before. So I really recommend watching those as well, if you are interested, and so you could gain more knowledge to begin your track to prevention and slowing down any symptoms or anything of congestive heart failure you may experience. Next slide, please.
Yeah, so something that sometimes heart failure is described almost as a roller coaster, and you can kind of see that here with the shape of this little image that we have. And the reason why this is kind of said is because heart failure is an insidious syndrome. So we mentioned this word insidious before, and what that really means is it's hard to know that you have heart failure because it starts before you experience any symptoms or any signs. So um, what we have here is you can see how the progression of heart failure is split into 4 stages. You have stage A, B, C, and D. And you can see that in stage A, you are at high risk, but you are without any structural heart disease or uh, experiencing any symptoms. And in stage B, you can see that you have structural heart disease, but you're still without any signs or symptoms. And in these 2 stages, these are the stages where we're still able to kind of prevent the onset of heart failure. So these are the stages where we know that maybe you're not really on the right track, but there's things we can do, for example, exercise-based interventions, and that can help improve your health and prevent heart failure from occurring. Whereas in stage C and stage D, what can actually occur is this is the exacerbation phase where um, your heart disease becomes worse and worse, and eventually it'll lead all the way to refractory heart failure. So the idea here is we want to be we want to be staying careful and staying vigilant because we want to be able to monitor our heart failure, and that's where the Kansas City questionnaire kind of comes in because you're able to kind of monitor at what stage you really are in this graph here, if you're really at a place where you can still prevent heart failure, or if you're at a place where heart failure is something that we're viewing more as something we have to treat now. Because as again, when we do develop heart failure in 5 years, 50% of all patients unfortunately pass away. And that's an incredibly important thing to try and avoid. So later on today, we'll be talking about different types of exercise interventions and different ways that we can try to prevent heart failure from happening and prevent heart failure from worsening.
So this is actually a very important slide. You can see if you just backtrack, you mentioned this roller coaster ride. The problem with this disease, it's not a linear relationship. So you go to the emergency room, and actually some of the best predictors of unfortunately passing away is being hospitalized. So if you require a visit to the emergency room or to the hospital for congestive heart failure, you're often giving a diuretic called furosemide or Lasix. You feel better you walk out of there, but it's going to come back. And each time, like a concussion, it just concussions injure your head, concussions to the heart called congestive heart failure injure your heart. It never bounces back to normal. You're left with a problem. And you can start very earlier on, which I hope to say is that you want a body mass index between 20 and 25. You want your blood pressure, ideally, between 110 to 120 over 70 to 80 over time, which I know is not realistic for many of us. One of the foundations of activity is doing those 10,000 steps every day and finding some time for activity, because the heart is designed, like any muscle, to be used, not to be overused, but to use properly. And once you're hospitalized with congestive heart failure, you're now on a slippery slope. You're in trouble. And the more hospitalizations that you have, the worse off you are. So being hospitalized for congestive heart failure or requiring extra visits to your doctor's office for congestive heart failure are worrisome signs. Still not too late to change, but you can see the clock. So this is actually a slide we call frailty. And you can look out from very fit #1 to just being severely ill, being in bed, require assistance for daily activity. Many people feel that having a cane or a walker is not a good thing. Well, it's a great thing if it keeps you mobile and keeps you moving. Once you lose your ability to ambulate, to walk, with or without age, you're in big trouble. So what I want you to do at some point in time, go back and look at this slide, freeze the screen, and decide, are you at #1? Are you at a 5? Are you at a 7 or 9? Because that really tells how frail you are, what's going to happen to you over time. Next slide, please. Now, this is probably, go ahead. This is an extremely important slide. A lot of people are going to talk about this. Go ahead.
Yeah, so this is certainly an important slide. And the one thing that you want to take away from this slide is that heart failure is a multifaceted disease. It's a very complex diagnosis. You can think of it as, heart failure may present as shortness of breath, which can lead to, feeling less motivated to be able to exercise, but that can also lead to a number of other complications. It can relate to the lungs, relate to the liver, relate to the kidneys, etc. If you also have complications with any of these other organs, well, it can also exacerbate some of the symptoms that you experience with heart failure. This can lead to a worse quality of life, and if heart failure gets too far, then if you go back to that whole idea of the roller coaster, it can almost feel like a roller coaster you can never get off. And that's why it's so important to recognize the signs and symptoms early, because here at the clinic, we don't want to necessarily treat heart failure. We want to be proactive to actually prevent heart failure. And that's why recognizing and managing heart failure early is really important. So while Frank mentioned that maybe the symptoms occur after heart failure has already occurred, heart failure is occurring before you may experience the symptoms, it's always important to ask yourself how you can take care of yourself and prioritize your health by asking yourself what you can do better now. And that's why this slide is so important. It's to emphasize that heart failure is a complex diagnosis that affects your whole body, subsequently leading to a reduced quality of life and shortening your quality of life and also shortening how long you might live as well. And that's why being able to manage and be proactive is so crucial.
If we just backtrack one slide, we're designed to have a body mass index between 20 to 25. We're designed to do 10,000 steps every day of our life. We're not designed to eat processed foods, 60% of our calories. And one of the consequences of being overweight, it stiffens your heart, makes the heart work harder. It affects your lungs. It can cause some scar tissue fluid accumulation. It's now the leading cause of liver cirrhosis. At one time, it was alcohol and viral hepatitis. Now, just being overweight, the liver is a filter. It can't stand these excess calories. The visceral fat, or the fat in your mid-gut area, is very metabolically active, and it sends out signals that causes cancer, kidney dysfunction, Alzheimer's disease. And it also damages muscles, so you can't be as active. So I hear this all the time, is that I don't understand, Dr. Cunningham. I've been overweight all my life, and why am I short of breaths now? It's a cumulative effect over time. Your body can compensate for so long. So to me, is that it's a cumulative blood pressure, the cumulative cholesterol, cumulative blood sugar over time. So it's not something that's going to happen suddenly. It's going to be gradually. So this is my plea to everybody, is that over 70% of people that I see have a weight issue. I know it's the hardest thing in the world. I'm hungry all the time. I'm struggling. I'm up 10 pounds. I'm down 5 pounds. I'll be hungry for the rest of my life. But I want to be hungry and weigh a little bit less. So please take this opportunity. You know, we're going to show you some fancy tests. Once the stomach arrives before you do, I don't need a fancy test to say you're going to have more cancer, you're going to have more infections, you're going to have the heart disease, you're going to have more stroke, you're going to have more atrial fibrillation, you're going to have more diabetes. So yes, it's hard, but you know what? Very doable. You can do it. And so can I. Now, this is actually a complicated slide. And this is something that in medical terminology. So if you look on your heart, on your left, you have something called HFpEF2. So H is for heavy. If you have a body mass index over 30, you get 2 points. If you have high blood pressure taking 2 medications, you get a point. If you have atrial fibrillation, irregular heartbeat, you have 3 points. Now, pulmonary hypertension is something that I measure on the echo, so you have to ask me. If you're over the age of 60 years of age, you get a point. And another criteria we use on the echo, that's why the ultrasound test is very helpful to us, is that it looks at something called the filling pressure. On the right is another scoring system that we can use, and this is more AVA. So the one on the left is more a clinical diagnosis. The one on the right has more markers. That's what I use the echo for. So if your heart muscle is thickened, it means your heart is in trouble because you're overweight or your blood pressure is too high. If it loses its elasticity, there's something called BNP or pro-BNP. You can see numbers from 30 to a couple hundred in this circumstance over here. So I think is that BNP or pro-BNP, these are hormones that we spent a lot of time talking to you. Currently not covered by the government, costing $75, but gives you tremendous insight. It's a marker, unfortunately, of bad things to happen, including death. So we talked about in the previous slide, if you're being hospitalized for heart failure and trouble, if your BNP, pro-BNP is elevated somewhere over 100 to 1,000 or so, depending on many circumstances, it can predict bad outcome measurements. So that's something that can be very, very useful. You can just talk with me if that's something that should be done for yourself. Next slide, please. And again, you don't really need to have these tests most of the time, is that once you're over the age of 60, you get a point, and your probability of heart failure is now 10%. Next slide, please. If you now are heavy, you get 2 points. The probability of heart failure goes up to over 50% or so. Next slide, please. If you're now on top of it, have high blood pressure on 2 medications, your probability of heart failure is 70%. So just by age itself, over the age of 60, heart failure is more of a disease as we get older. If your body mass index, again, is at 30 or greater, you can see that you're putting great stress on your body. And most of us have high blood pressure as we get older in life. And if you're taking 2 blood pressure pills, the probability of that shortness of breath or that leg swelling coming from the heart approaches 70% or so. So think about steps that you can make. And when necessary, we can certainly look at the parameters. And again, is that I hope you walk away from here is that it gets harder as we get older to make change, but it's certainly not impossible. My plea to everybody is to think about investing on a good blood pressure machine and measuring your blood pressure on a regular basis. It's the burden of blood pressure over a lifetime. I'll measure it next time. I'll get a machine next time. I don't really need a machine. Yeah, you need a machine. Everybody needs a machine to do things well. And so this is something I need to think about. And everybody needs to think about how they're going to work on their weight better. I know it's hard, but you can have some fun doing it. Next slide, please. So this is yesterday I was in clinic, and I got a quick phone call saying, Mr. BK, when your patient's Dr. Kernew, his blood pressure is good. He's quite skinny. You can see body mass index of 19.6. We're going to send him home tomorrow. And I said, okay, what's happening? Well, he came with shortness of breath. If you can look at this, he was hospitalized in March with COPD, April, congestive heart failure, gastroenteritis, acute liver injury, congestive heart failure. He's a little bit anemic. His kidneys are working at 30%. His pro-BNP is 7,000. He has a background of congestive heart failure, hypertension, and COPD. Can I just send him home, Dr. Kernew? I got really nervous. Next slide, please. This is why I got nervous. He's been hospitalized 5 times recently. And we mentioned that slide that Stuart showed you about that overweight individual, COPD, lung disease, pneumonias. We look at the bowel, the kidneys, heart failure. This person's had 5 hospitalizations. And I'm sure heart failure was involved in all 5 of them. If you remember that slide that we talked about, is that being hospitalized is a bad outcome. You don't truly bounce back. And so if you smoke, give up smoking. If you, so this is actually, and this pro-BNP is not a little bit high, it's 7,000. Unfortunately, what this person needs, unfortunately, is palliative care. This person is towards the end of their lifetime. We can see by these recurrent hospitalizations, by the fact that the pro-BNP is 7,000, and again, normal is less than 100 to 200 or so, atrial fibrillation a little bit higher. And so for this person, unfortunately, it's too late for long-term recovery right now. Is that there's always room for miracles and Hail Marys, but this problem didn't start yesterday. It starts the day you're born and working forward. So I'll be glad to see this person in my office, but I need to really emphasize is that there's not too much time left in this individual, and how to maximize the time that this person has left. And so it's always a sad state of affairs. And so don't wait for the end. Start at the beginning. Next slide, please.
Yeah, and this one patient isn't really the end of the story, because as it says here in this infographic by the U Ottawa Heart Institute, heart failure is a silent epidemic in Canada. And the reason why it's a silent epidemic is because, like we said before in that roller coaster slide, it's really hard for you to know that you're developing or progressing into heart failure when there are no symptoms or there are no signs initially that let you know. So it's really, really important for you to be always monitoring and always maintaining a healthy lifestyle, because as we mentioned a lot of times already, when you do get heart failure and are diagnosed with heart failure, 50% of the patients who are diagnosed with heart failure will die within 5 years. And you can see all these different statistics here about how there are 600,000 people affected by heart failure in Canada, and it's the number 1 driver for unplanned hospital admission. If I'm not wrong, heart failure also is contributing to one of the second leading cause of death in Canada as well. So it's definitely really important to watch out for heart failure and be able to recognize how you are progressing and how your health is, and always be vigilant of your heart failure status.
So the message here is as we get older, heart failure becomes a bigger problem, and you can make yourself age well. Remember that picture of that couple on their bike being of a good weight and good blood pressure. So it doesn't have to be this way. It doesn't have to happen to you.
So to continue on this same idea about the dangers of congestive heart failure and why it is truly a silent epidemic in Canada, it's especially dangerous due to its high morbidity and mortality rates that are associated with congestive heart failure. And despite advances over the years in medicine, the mortality rate for mild to moderate heart failure still remains at about 20 to 30% 1 year after diagnosis, and 50% for individuals with severe heart failure 1 year after diagnosis. And this number we keep repeating, it overall does have a 50% mortality rate 5 years after diagnosis. And this isn't even considering the long list of complications that could arise as a result of congestive heart failure, which further worsen the patient's condition and quality of life. And it's worrisome that as the condition progresses and hospitalizations increase, patients become more resistant to the treatments available for congestive heart failure. Next slide, please. So what especially can cause congestive heart failure to happen? Well, it could happen due to many reasons. One of them being essentially people may not follow some dietary recommendations that doctors give their patients, one of which is to decrease salt consumption. So for many individuals, continued and increased salt consumption is a contributing factor to this progression. And this is because that with increased for increased salt absorption or consumption, there's greater water retainment in the blood, which thereby increased blood volume and increased blood pressure through that. And since your heart has to pump now against even greater pressure, it's forced to work harder, which contributes to the progression of congestive heart failure. Additionally, some medications taken may actually worsen congestive heart failure. Some examples of these are specific antihypertensive medications, calcium channel blockers, antiarrhythmics, among many others, and they may exert a negative effect on the heart experiencing heart failure. Now, the special effects on the heart depend on the specific medication, but it could range from exerting a toxic effect on the heart muscle or to slowing heart rate and weakening heart contractions, relaxing the heart too much, or changing the heart rate in general. Also, you may have some medications that may worsen hypertension, increase sodium levels, or interact with other medications, which decrease the effectiveness of heart failure medications. And this is why it's very important to consult with your doctor about your medication to make sure that none of the medications you are taking do interfere with your condition. Next slide, please.
Just before you move back one slide there. So I got a question to everybody, to Frank and to Stuart and everybody else. So what's more important, salt or calories for causing heart failure, you think? If you had to limit salt or you had to limit calories, what would have the best impact on heart failure? Any thoughts? I'll tell the answer. It's calories. Salt certainly can cause fluid accumulation, but it's relatively small. I think we punished salt for a long time. What we haven't punished is calories. Is that it's the excess of weight that's the most important thing to think about. I would rather you eat a ton of salt and no calories. Kidding around a little side, but if you're inactive, you need about 1,200 calories to 1,500 calories a day just to do things. And if you want to lose weight, you have to be under 1,000 calories a day. I know of very few mortals that can live under 1,000 calories a day for very long. So my plea to everybody is to think about what you're going to put into your system, and also too, if you're put on medications, take them. If you have a problem, talk to the person who gave it to you. It turns out is that close to 50% of Canadians decide that what to do with their medications. I don't know about you, is that I don't play with my electric panels, so don't play around too much with your medications unless you know what you're doing, and work with your doctor to make that happen better. I love the next slide. What's the next slide tell us?
Yeah, Dr. Kearney, that's a great segue into our next slide about talking about what you're actually putting in your mouth and consuming and putting in your body. So hopefully by now members of our audience have been able to go through the KCCQ. That was the first actionable item that we talked about today. First talking about predicting your heart failure. Now we want to talk about the second actionable item, the first thing that we recommend you trying to do to sort of prevent heart failure, and that is consuming a healthy diet. Diet is one of the best ways to manage and prevent your heart failure. And we just want to quickly run through some foods that you should try to promote in your diet and other foods that you should try to reduce in your diet. So if you look on the right hand of your screen, you'll see an arrow that points upwards, and the foods that are higher at the top of the arrow indicate health foods. These are foods that are good for you to put in your body, of course in moderation, in good amounts, because as Dr. Kearney said, excess calories are excess calories. But focusing on foods like fruits, nuts, fish, vegetables, vegetable oils, whole grains, beans, yogurt. A lot of these are rich in fiber, rich in minerals. In the case of fish, rich in omega-3s, which promote good heart health. These are all foods that are considered health foods, which help fight the disease. As you see at the bottom of the screen, you can either feed the disease or fight the disease with the food you put in your body. If you look towards the middle of the arrows here, you see foods like dairy products, cheese, eggs, poultry, milk, butter, unprocessed red meats. Now, contrary to common belief, for some people, these are not considered health foods, and reducing these in your diet will be one important step that you can take to sort of slow the progression of heart failure. And as you can see, as you go lower down, we get to things such as refined grains, sugars, starches, processed foods, foods that are very rich in sodium, as well as industrial trans fats. These are all harmful foods to your body, which contribute to feeding the disease, which subsequently can exacerbate your heart failure and help accelerate the progression of heart failure so that you get into stage C and stage D much faster than someone who is eating healthier. So while changing your diet certainly isn't easy, I think the main thing that I want to encourage everyone to do with this second actionable item, is to make small measurable changes in your diet over time. And that can sort of get you on the right track. I think my mom always has a really interesting quote. She always says that you only have one body, so if you treat it right, it will treat you right as well. So I would really encourage everyone to come up with maybe one goal by the end of today's webinar that you can do to try to improve your diet. One thing that, for example, I've done recently is whenever I'm feeling sort of snackish and I want to reach for some carbs because I'm someone who really enjoys crackers and chips more than sweets, I always tell myself that I'm going to eat a piece of fruit before that. That way, if I am to go to grab the chips, for example, I'll be eating less amounts because I've already filled myself up with food prior to actually grabbing that bag of chips. And very often, a lot of times, I actually find myself feeling satiated and feeling full even after having that apple or having that banana itself. So that's something that's sort of been a small, measurable change. It's not me uprooting my diet, but it's me making a small change, which I know is having an important positive impact on my heart health. Next slide. So now this leads us into the conversation Dr. Kearney was bringing up earlier about calories. Calories maybe being a bit more important than just focusing on the amount of sodium in your diet. So a lot of people maybe will come into the clinic and they'll say, well, you know, Dr. Kearney, I'm eating less food. Why am I still maintaining the same weight? Or other people will say, I'm eating the right things, so why is it not making a difference? Well, so much of it actually has to do with portion sizes and what foods they're actually putting into your body. So if you see on this diagram, foods have different calorie densities depending on what they are. For example, 500 calories of oil or cheese, which you see on the left-hand side of your screen, only fills up about 1/3 of your stomach. That picture you're seeing right there is the human anatomy. That's your human stomach. But 500 calories of healthier foods like whole grains, fruits, and vegetables fill your stomach up 2/3 to the full amount and make you feel fuller longer. These foods in particular are high in high volume, low calorie foods, which are filled with vitamins, minerals, and most importantly, fiber. And these are foods that will help you stay fuller longer. What's also interesting about vegetables and fruit that I don't think is talked about enough is these are foods that actually take longer for you to chew. They take longer for you to chew in your mouth, and that forces you to slow down and be mindful of the things you're eating. And that will also help you to recognize when you're feeling full before you actually overeat and then start regretting it for the rest of the evening. So this is why plant-based foods really help keep so many people lean and satisfied in Canada and the rest of the world. And while this is not to necessarily promote a full vegan and vegetarian diet, it's rather to encourage everyone to think about trying to integrate as much fruit and vegetables in your diet as possible. As you can see, Dr. Kearney just ran to the kitchen to grab himself an apple, it looks like. And this will certainly help with your energy levels, certainly help with weight loss, and overall improve your heart failure prognosis.
So to continue with what causes or contributes to the progression of congestive heart failure, respiratory diseases and infections have also been observed to worsen the condition. So respiratory diseases and infections increase the risk of complications associated with the heart, and this is mainly due to infection, which can result in inflammation and interferes with the proper functioning of the heart muscle and would require your heart to work harder just while your body is in that sick state. By affecting the functioning of the heart muscle in those already affected with congestive heart failure, respiratory illnesses present a major risk for adverse complications, hospitalizations, and progression of congestive heart failure. Now, one study looked at this, the Organized Program to Initiate Life-Saving Treatment in Hospitalized Patients with Heart Failure, or the Optimize HF study. followed 48,612 heart failure patients across the United States, and they determined that respiratory illnesses were a contributing factor to hospitalization and worsening heart failure conditions, accounting for 15.3% of hospitalizations. And it was also associated with a 1.6 times increase in mortality. And I think it's important to note here, that's why it's very important to be up to date on your vaccinations, including ones like the flu and pneumonia vaccinations, and more common now, the COVID-19 vaccine, since they could greatly decrease the risk of adverse reaction from infection. Next slide, please.
So one thing to remember is that if you get COVID, you're about 6 times more likely to have a heart attack in the next 2 months, and about 16 times more likely to have a stroke. So COVID's not a friendly disease to anybody, and it's not friendly to heart attacks, not friendly to stroke as well. So what I've done this year is that I got a lot more vaccines. So I got my shingles vaccine. I'm going to get my Prevnar 13, and I hope everybody's gotten their COVID vaccines. Vaccinations is a 30-year work in progress, and it's eliminated diseases from tetanus to polio to measles. And now we have the opportunity to put COVID in the back seat. I just hope people take that opportunity before it's too late. The disease is mutating.
So we have talked about how congestive heart failure is not only a danger due to having it, but its progression and how it leads to other complications. So what complications can arise? So all of these complications will not only contribute to a decline in health, but also a decrease in quality of life and a decline in being able to independently live as one did before. So liver damage and dysfunction is observed in about 20 to 30% of patients with acute heart failure. And the liver can be damaged because of 2 reasons. So either because of heart failure and the inadequate blood flow to the liver as a result of heart failure, there's damage at a cellular level due to the lack of oxygen delivery, which is called hypoxia. And interestingly, a study looked at this and saw that even with the return of blood flow, it's found to still worsen the condition. Also, with increased pressure in the veins transporting oxygen-poor blood out the liver, something called hepatic congestion can occur. And ultimately what happens is the blood cannot move normally out the liver and it pools in certain areas, which leads to damage of the liver and liver scarring. Now to continue, unfortunately, congestive heart failure can also damage the heart valves. So as previously mentioned, the heart experiencing heart failure undergoes structural changes such as enlargement. And the change in structure of the heart itself can damage the valves and affect their proper functioning. And also because of the higher pressure in the hearts of individuals that are affected by congestive heart failure, the higher pressure in the heart makes it more difficult for the valves to open and close properly, which puts them under more strain and it leads to their damage. Next slide, please. So not only that, but it could affect the heart in other ways as well. So you also have that heart failure could lead to the development of arrhythmias. And that is specifically irregular heartbeats or rhythms. And these arrhythmias can range from atrial fibrillation, that being when the heart's atrias beat irregularly and not in coordination with the 2 ventricles. And atrial fibrillation is actually very common in heart failure patients and has a 25% incidence rate within 5 years of diagnosis of heart failure. And they are very commonly associated with each other. People may also experience irregular heartbeats faster than normal, known as tachyarrhythmias, or even slower than normal, known as bradyarrhythmias. And this specifically occurs because of the changes in the heart structure. Again, as it tries to compensate for the lack of pumping ability, the heart's structure changes. And with these structural changes comes neural, electrical, and chemical changes over time that damage the heart muscle and impacts the heart's normal conducting ability, which essentially results in issues in the movement of electrical impulses throughout the muscle of the heart. And that's what accounts for the coordination of rhythm and beats. And that's why we have arrhythmia when that is interrupted. And continuing on, because of the inability to efficiently pump and distribute blood around the whole body, the organs in the digestive system also do not function as efficiently without their required oxygen and nutrients from blood. As a result, absorption decreases, so there's less absorption of nutrients, which leads to malnutrition. Malnutrition could also be caused by the symptoms of congestive heart failure itself, things such as nausea and swelling of the abdomen, which bring about discomfort in individuals that might limit their ability to eat and decrease appetite for food. Next slide, please. So you can see the effects of congestive heart failure continue to spread more and more across the body. Not only is it affecting the heart and the organs of the digestive system, but also it's felt by the lungs. Essentially, because of the inability to pump blood effectively, blood might pool in the vessels that transport blood from the heart to the lungs for oxygenation, and as a result, the pressure within those veins increases, which forces fluid into the alveoli of the lungs. Now, the alveoli of the lungs are the spaces within your lungs where oxygen enters the blood while carbon dioxide is released. And this essentially limits the movement of these gases through the lungs and will result in shortness of breath. And this is specifically referred to as pulmonary edema. And additionally, if this continues, the pressure within the pulmonary artery will continue to increase, which results in pulmonary hypertension. And to continue, like has been mentioned before in the specific case study, kidney damage could also occur, or kidney failure, and it's commonly seen in patients with congestive heart failure, especially since the heart's not able to pump enough blood around the body. The inadequate blood flow leads to kidney damage due to the lack of blood delivery and contributes to the patient's worsening condition and quality of life, and they also require dialysis treatments now to compensate for the kidney's loss of function. Next slide, please. And
So if I got this right, what you're saying is that we go back to some early signs. So I'm 62 as of to this presentation. My blood pressure is 120 over 82. I'm exercising. I'm not particularly short of breath. So I think I'm good right now. But let's say my twin brother, who is the same age, 62, has a body mass index of 30, taking 2 blood pressure pills. The legs are swollen, I'm short of breaths. And then I get something called an arrhythmia called atrial fibrillation. I'm short of breath because I have some pulmonary edema and my kidneys aren't working well, and I'm starting to develop diabetes. So you're painting a picture of my twin brother, Dr. Jekyll and Mr. Hyde. One has made some better choices and one has not made some better choices. So the clock's ticking. Thank you for sharing that. Keep going. Keep telling us the story.
yeah, and it could spread even beyond that, affecting the brain. Essentially, again, we get back to this theme of the altered pumping ability of the heart with congestive heart failure. The risk of experiencing a stroke increases. And this is thought to be due to the formation of blood clots because of the abnormal contractions and structures of the heart, specifically the left ventricle. And if the patient specifically experiences atrial fibrillation, blood clots may form from the abnormal beating associated with atrial fibrillation. And if that blood clot was to be pumped out the heart and get stuck in a vessel leading to the brain, the blood flow can be interrupted, which leads to a stroke. Additionally, those with heart failure have been found to have higher levels of factors that promote blood clot formation as is. And in fact, individuals with congestive heart failure have a 2 to 3 times higher risk in experiencing a stroke. And this risk increases even more when you consider those with congestive heart failure and arrhythmias together. Atrial fibrillation is an arrhythmia that's very common in many individuals, as mentioned before, and with heart failure and the risk of experiencing a stroke is about 5 times higher for individuals with both of these health conditions. And that's in comparison to healthy individuals. So as you can see, congestive heart failure progression itself can lead to a large array of complications with each requiring its own treatment. And this can complicate the condition much more because not only does the individual have to follow multiple treatment plans, but the treatments for each condition must be carefully constructed so you don't have certain medications or treatments conflicting with each other. Like mentioned before, that's a cause for the progression of CHF. And additionally, it leads to a greater decrease in quality of life and higher risk of mortality. So my main takeaway from this section would be just to take action and make changes to live healthy lifestyles, like mentioned before, improving diet, decreasing weight, increasing exercise, among many other options you might have, and especially follow treatment plans and doctor's advice to the best of your ability, as the development and progression of congestive heart failure can lead to very unfavorable and difficult outcomes.
So if I got this right, so there's me and my twin brother. So myself, I'm taking 40 milligrams of Crestor, and every once in a while I take a little bit of Ozempic to help curb my appetite. I work with Mira and Devanshi on the Weight Loss Club. I work with Jerry and his team with the movement meditation group, and they make me feel better for all these thoughts that I have in my mind. We're doing our cooking this summer with Aditi. I'm trying every 30 days something new, where my twin brother said, I'll get a blood pressure machine later. Boy, that hamburger really looks good. Stuart said I either feed the disease or feed the illness. So my twin brother has diabetes, taking 3 pills for diabetes, has atrial fibrillation on blood thinners, has had a stroke, and then had a GI bleed from his anticoagulants, taking 3 blood pressure pills. Geez, we're twins, and we're on different paths right now. You can just see that congestive heart failure is a complex where the heart has trouble pumping to the rest of the body or does it at a higher pressure. But you can see other organ systems get involved as well, from the kidneys to the eyes to the brain. And by the way, my brother's going to develop Alzheimer's disease much quicker than I will, because he's already damaged his brain, and damaged brains lead to Alzheimer's disease. And he's thinking he no longer can work anymore. He's kind of feeling unwell and depressed at this point in time, and we're trying to figure out what retirement home my brother needs to go to at this point in time. So I have some choices there, and I realize that they're tough choices, but boy, if you look at the pluses and minuses, I'm going to encourage my brother to maybe come for a little walk tomorrow and make some changes. And I hope you bring a friend too as well to make some changes before it's too late.
Yeah, and continuing, like you mentioned, Dr. Kernew, about buying like a blood pressure machine. This is why we're going to get into right here why it's very important to check your blood pressure. Because hypertension specifically can lead or can exacerbate congestive heart failure. But hypertension itself, just to define it, it is an increase in blood pressure, and defined by the CDC as a blood pressure greater than 130 millimeters of hydrogen over 80 millimeters of hydrogen blood pressure. And the 120 represents
millimeters of mercury. So basically, the classic definition of blood pressure is 140 over 90, but we realize that the best blood pressure is 110 over 70 to 120 over 80, and that if you have existing diseases, sometimes even lower. So yeah, thanks for sharing this. So and blood pressure is measured in different places. So keep sharing, keep telling us. Go ahead.
My apologies, I misspoke with the hydrogen. It is millimeters of mercury. But yeah, essentially, you have 2 measurements, just to kind of recap, where the 130 represents your blood pressure during systole, or when your ventricles of the hearts are contracting to pump out blood, and the 80 represents your blood pressure during diastole, which is the relaxation phase of the heart. Individuals with hypertension essentially have increased peripheral resistance, that being an increased resistance of the arteries to blood flow. And as the heart works harder to overcome this high blood pressure and increase peripheral resistance, it becomes overworked, which leads to hypertrophy or enlargement of the muscle. And this is accompanied by the thickening of the heart muscle, which reduces its contracting ability. Now, the heart can no longer pump blood as effectively as it did before, which leads to the development of heart failure. Since this is mostly localized to the left ventricle of the heart, the site where blood is pumped out of the heart to be delivered around the body, this enlargement of the muscle is usually referred to as left ventricle hypertrophy. Next slide, please.
So just as Mustafa so elegantly shared, managing your blood pressure is really crucial. And I want to get into why that really is. So if you ask any researcher what's one of the best, strongest pieces of evidence in literature, it would have to be a meta-analysis. And the reason why it's a meta-analysis is because in these types of studies, researchers are pooling many other studies that researchers have done to kind of figure out what's the main trend here, or what is all the research telling us. So it's not a single team of researchers, but it's every single researcher who's contributed to this sort of topic putting their heads together and coming up with an effective idea or an effective conclusion. So this was a meta-analysis of 12 different studies, and it was investigating medications for reducing blood pressure and how that contributes to lowering your cardiovascular events. And as you can see, we'll go by one by one. For reducing stroke events, you can see that there's a 38% reduction in stroke events with effective management with antihypertensive medications. When it comes to coronary heart disease, a 16% reduction and a 21% reduction for all vascular events. For left ventricular hypertrophy, which Mustafa so elegantly described to us what that is, there's a 35% reduction. And finally, for heart failure, which is the main topic of today's presentation, there's greater than a 50% reduction in the possibility of developing heart failure with effective management from antihypertensive medications. And the main takeaway really is that reducing your blood pressure puts such a significant lower strain on your heart, which can have a wealth of cardiovascular and health benefits. And while medications are certainly the first step to helping you get there, it's also important to be conscious of how a healthy lifestyle, a healthy diet are also promising and important interventions that you should undertake to get the best course for your heart failure moving forward.
Yeah, I think this is the key slide for everybody to think about is that knowing your blood pressure, lowering what happens to your blood pressure over your lifetime is important because as Stuart's going to show you, about 90% of us will develop high blood pressure during our lifetime. And for every 10 millimeter reduction in blood pressure, you can decrease the chance of a heart attack by 20% and stroke heart failure by 30%. This is huge. And it's not the blood pressure of today, it's the blood pressure over a lifetime. And yes, blood pressure fluctuates. So you want to make sure you measure at home often and repetitively. We have so many videos on this, and this is really a key slide to think about. So this is really an actionable phase about everybody should have their own blood pressure machine and keep track of it, period.
So in one of the most significant studies conducted on hypertension and heart failure, the Framingham Heart Study, which followed 5,143 individuals, found that out of all patients diagnosed with heart failure, 91% previously had hypertension. The study concluded that hypertensive men were twice as likely to have heart failure and hypertensive women were 3 times as likely to have heart failure compared to individuals with normal pressure. And I think this study really highlights why the importance of taking care of your health and monitoring your blood pressure, either by going to a doctor or getting your own at-home blood pressure machine, should be emphasized, since hypertension itself can start a cascade of events which lead to the development and progression of congestive heart disease, which even itself can lead to even more complications like we showed before. Next slide, please.
All right. So you guys kind of saw how the congestive heart failure can lead to so many different problems and can arise from so many different problems. So it's really important to be able to self-assess your current health status with regards to heart failure. And one of the best ways you can do that is with what we introduced at the very beginning of the presentation, the KCCQ, or it's also known as the Kansas City Cardiomyopathy Questionnaire. So to really explain a little bit about what the KCCQ is, it's essentially what is known as a self-administered questionnaire. And what that means is you can look at it yourself, you can take it yourself, and you can interpret the results yourself. And you know, and you have a record for yourself that allows you to measure your symptoms, your functionality, and your quality of life with regards to heart failure and how that's really impacting you. So how this kind of works is the questionnaire will ask you questions about, for example, let's say, how is your shortness of breath really impacting your life? And it'll give you options like not at all, or a little bit, somewhat, a lot, etc. And based on which option you choose, it'll give you a score for that one question. And you take all these different questions that they ask in the questionnaire together, and you combine the score together, and you get a total score. And the total score ranges from 0 to 100, as we kind of mentioned before. And what this score allows us to do is it allows us to measure quality of care, essentially quality of care that you have been taking care of yourself, key clinical events in CHF, as well as it allows you to self-assess and self-monitor CHF. And just to interpret the scale a little bit, So it ranges from 0 all the way to 100. And typically what is said is 0 to 24. 0 to 24 is typically very poor to poor health status. So you really want to be avoiding this. 25 to 50 is poor to fair health status. 50 to 75 is fair to good. And in the green range here, it's good to excellent, 75 plus all the way to 100. So this is where we want to be and we want to stay. We'll be talking a little bit more about what each of these definitions or the health statuses really mean in terms of heart failure a little bit later. But moving on to the next slide, we have this here, a really great illustration that kind of maps out the Kansas City questionnaire and tells you what exactly it's testing. So we actually have two Kansas City questionnaire scales. We have the clinical summary scale, but what we want to be focusing on is this one, the overall summary scale, which is what is typically used for self-assessments. And you can see that this overall summary scale includes questions that target your symptoms. So if you're developing any symptoms of heart failure, like if you're being fatigued, or dyspnea, which is shortness of breath, or edema, which is swelling. And it also mentions questions that kind of target if you are experiencing any limitations in your day-to-day life. So any physical, emotional, or social limitations. And also if any of those limitations are really impacting the quality of life. So if you're feeling like you're not able to have as great of a healthy, functioning lifestyle that you want to have, the Kansas City questionnaire kind of quantifies that into a score that you can use to kind of interpret how heart failure is really progressing and impacting your life. And here we have the results of a study. So this is a study that kind of compared the Kansas City questionnaire to a whole bunch of other scores. So including the 6-minute walk test, the New York Heart Association scale, which we'll briefly touch upon a little bit later, and a whole bunch of other tests that have been proposed to predict for heart failure. And we can see that the Kansas City overall summary score is actually really great at predicting not only for deterioration in heart failure patients, but also improvement in heart failure patients compared to a lot of the other scores.
So this is actually very important. If you just backtrack one slide here, I, as a practicing cardiologist, have not been using this questionnaire. And today is the time we're going to just start to use it. It's used a lot in research projects, but you know what? In black is the Kansas City questionnaire of congestive heart failure. And it turns out to be probably the best predictor. Now, I don't want to rely on one criteria. I mentioned in that blue there, BNP or pro-BNP, as that you can see, its predictive value isn't as strong in this observation. This is an older trial from about 2005 or so, and I learned a lot about BNP since then as well. So, and you want to combine the best. And right now, I'm just asking how they feel, which is what you call New York Heart Classification. The 6-minute walk test turns out to be the second best predictor. So my encouragement to everybody is to fill out the Kansas City questionnaire and do a 6-minute walk test, because we know if you can improve your walking distance by about 40 millimeters, you're going to feel better. And if you improve your Kansas City questionnaire by 5 units, you're going to feel better and do better as well. So I think it's time to integrate this into practice, and it's something that you want to do on your own on a regular basis. And we have Adam and Daniel at the end that's going to tell you how you can get to a project about how we can get you healthier, and also how you can monitor it the beginning and 30 days later. So this is actually really important research that says that the Kansas City questionnaire, followed by the 6-minute walk test, are very valuable. We use lots of things like, a patient just asked me, I would like to have an MR study of my heart or my chest or an angiogram. You know what? Turns out this questionnaire is probably better predictive, and a 6-minute walk test is pretty predictive. If your belly buttons arrive before you do, if your blood pressure is above 130 to 140 systolic range, you're in trouble. So these are the things to think about. So this is a game changer. So again, if you haven't completed the questionnaire yet and you haven't done your 6-minute walk test, please do so this weekend and do so on a regular basis. So this is actually very, very important and very helpful and quite simple.
So as Dr. Kearney said, it's always a good idea to look into more than one source to sort of come to a decision on whether something's good or not for your health. So here's a little bit more evidence on how effective the KCCQ is at predicting death as well as heart failure hospitalizations. So I'm going to briefly run through how you read this little complex diagram here. So as you can see on the y-axis, that's this line going up and down, you'll see different categories. There's all-cause death, there's heart failure hospitalizations, as well as death in heart failure hospitalizations. So there's 3 different categories to this chart. And on the x-axis, which is the horizontal line, you see something known as a hazards ratio. And essentially anything greater than a 1.0 suggests that there's a greater possibility of something occurring. So with that in mind, let's briefly go through what these essentially mean. So going up to the category of all-cause hospitalizations, you can see that an individual with a score in the KCCQ of within 75 to 100 has the chance of heart failure hospitalizations at, baseline, 1. However, if somebody actually has a score between the 50 to 74 scale, you'll see that it increases to about 1.38. So your odds are about a 38% higher chance of actually developing all-cause death simply because you had a lower score. So it's really suggesting how effective this tool is at sort of measuring the state of your heart health today, 5 years from now. And that's why we encourage everybody to really do it. If we go down into, for example, a score of 0 to 24, you can see that the chances are about 2.5 times greater of developing all-cause death simply because your score isn't up to par with somebody who's in the 75 to 100 percentile. So that's why I really do encourage everybody who is joining us today. If you are joining us today, it means you're being proactive with your health. We encourage you to take that one more next step to take this little quiz and see where you fall in the spectrum, because having a good idea of where you are today can sort of motivate you and inspire you to create a better tomorrow for yourself. So you're not going to be stuck in one spot. Just because you're somewhere now on the spectrum doesn't mean you will be 5 years from now. So being proactive and taking charge of your health is important, and that's why we really encourage everybody to take this quiz or take this test with us. So if we go on to the next slide here, I believe I'll get Frank, who's going to talk about why, again, this is so important.
Yeah, so just to really summarize everything, the KCCQ is really important because it allows us to kind of track our heart failure status, and especially in CHF, when a lot of the times our key goals are preventing CHF and limiting progression of CHF, that's something really valuable to have. So a question that comes up kind of often is, when do you really want to take the Kansas City Questionnaire? And to answer that, the Kansas City Questionnaire can be taken minimally at least every 2 weeks. So that's the longest time interval that you should be taking the Kansas City Questionnaire, because the Kansas City Questionnaire actually gives you a recall period of 2 weeks. So for example, it'll ask you, in the last 2 weeks, how did shortness of breath impact the ability for you to really do the actions that you want to do? However, if you're like me and you can't even remember what you ate for breakfast 2 weeks ago, it might not be great or accurate to use 2 weeks as kind of a measure, because you might be falling into something called recall bias, where you're not able to accurately recall the information or how you felt of your state at that point 2 weeks ago. So if you want to do it more frequently than 2 weeks, I definitely encourage that. And it's really great because the Kansas City Questionnaire is really fast to complete, and you can fit it into your schedule pretty much anywhere. Because it only really takes 4 to 6 minutes to complete. It's only 15 questions. They're not really difficult questions, and you should be taking it. Honestly, you can take it first thing you do when you wake up. So this is another one of our actionable items. Really getting on to the Kansas City Questionnaire, really being able to remember to take it every week or so, and knowing that it only takes 5 minutes out of your day. It's really important, incredibly important, and it takes barely any time out of your day. And so if you're also like me and you have issues with organizing and scheduling, what you can do is there's this great app called Google Calendar, and you can actually schedule recurring events on Google Calendar that allow you to that gives you a notification every 2 weeks at a specific time that you want to be doing your Kansas City questionnaire. So it's really great to have as well in case you forget.
Kind of interesting. I don't know how often you should do it. I did it for the first time in my life yesterday. And so, but I encourage everybody to get a baseline to see where their starting points are, and to use it to help motivate yourself and just know where you are for. So that's great. So it's something that that should be part of our clinical practice, and it's something that's changed right now. So thanks for sharing with us. So it just tells you a lot of information. I think we're all used to going to school, getting grades between 0 and 100%. So this gives you that that 0 to 100 score. 100 being you're perfect, 0 means you're dead. Yeah, let's go forwards.
Yeah, so now let's get to the fun part here where we get to actually kind of go through the questionnaire and fill it out. So if you haven't already filled out the questionnaire, or you're joining the webinar a little bit late and didn't catch what we were saying at the beginning, you can actually find this questionnaire here. We've created a calculator here at the clinic that helps you calculate the KCCQ score. And you should really save this link, actually. You should bookmark it. So you can go here, you can press the star button if you're on Google Chrome, and you can bookmark the tab, add a bookmark, and it'll save for you on the bar here on top. So you always have access to it, because the calculator, at least when I was looking into it, it was hard to find in other places. So you can actually find it if you're not on the WebEx right now and you're watching on YouTube. You can find it in the video description. So that's just down here. You can press expand, and you can just click on this link right here, and that will bring you to this questionnaire here. So we're going to go through this a little bit, and I'm going to run you through again how you can kind of create your own copy on your own drive so you can work on it on your own. So if you go here and you press file, what you can do is you can make a copy, and because this here right now is it's a version that's shared by everyone, what you can do is you can make a copy and add it to your own local drive, and it'll open it for you, and you'll be able to edit it. Right now it is locked, just in case. So, but everybody should be able to access it through this file, make a copy into your own drive. If you aren't able to do that because you don't have a Google account, what you can do is you can download it as a Microsoft Excel, and that will send a download, and you can work on it on Excel on your own computer. So let's explore a little bit about this Google Sheet that we have here. So the first sheet that we have is one called Track Your Score. So this is because if you're repeatedly doing the Kansas City questionnaire, you want to kind of look at, your score on one day, let's say August 13th today, and you maybe want to compare with later down the road to see how you were and how you are now. Or so for example, if I completed the score later on, let's say like August 24th or something like that, then I can put my score in here, and let's say I'm going from like 100 to 95. And that you can clearly see that 100 to 95, there's a 5-point difference. I'm decreasing my score by 5 points, which means that it might mean that my heart failure is getting slightly worse. So this way you can kind of compare with where you once were and keep track in that kind of way. So let's go on to this document here, where in the beginning of the presentation, I started a little bit filling out some of the Kansas City questionnaire. So as a reminder, on the second sheet here that you have on your template, so this is a calculator template. So it's an empty calculator sheet that you can essentially just, you can right click and press duplicate. And what that does is it creates a new copy of this template sheet that you're able to edit. And what you can do is you can change the name just by double clicking. So I just double clicked on this name here, and you can change the name to the date. So let's say it's August 13th. And this is your score for August 13th. So we can fill out the questionnaire now. I'm just going to go through it a little bit quickly because we have 15 questions. But let's see, the first question says, heart failure affects different people in different ways. Some feel shortness of breath while others feels fatigue. Please indicate how much you are limited by heart failure, shortness of breath, or fatigue in your ability to do the following activity over the last 2 weeks. So personally, I think in my own life, I haven't been really limited by shortness of breath, and I think largely that's a part of me being young as right now. So I think I'm fortunate to be able to put 1 here at not at all limited. And you can see all these different options here. These are all scales that you can kind of determine yourself. So if you're not really too sure between extremely limited and quite a bit limited, uh, it, it's a little bit more of like a subjective scale. So you really have to kind of know internally, really evaluate internally where you are or what you think where you think you fall. You can also note that in this column here, it says limited for other reasons or did not do the activity. And this is just kind of a NA or a does not really apply to me uh, a column. And what happens here is if you put a 1 here in this score, it'll actually give you the average score of the uh, entirety of the other options. So this is kind of like a NA, not really applicable. So I'm just going to move on to the second question here as another example. So compared with 2 weeks ago, have your symptoms of heart failure, shortness of breath, fatigue, or ankle swelling changed? My symptoms of heart failure have become, well, thinking for me from 2 weeks ago, it's a little bit hard to remember, but my symptoms of heart failure don't really think they've changed very much. So I'm just going to leave it there as 1. And as you can see, there are a lot of different questions here that you can kind of just read and answer and look at the options. And there's sometimes a kind of like a not applicable or an NA kind of option that again really just puts your score right in the middle of all the other options. And if you fill this out at the very end, you can see this total here, total. And I here have a score of 58. But if you were to fill out the calculator completely, you would have a perfect score. Well, hopefully, ideally, you would have a perfect score of 100. And if you were to fill it out on the opposite end of the spectrum, where everything is just ones on the other end, the worst possible scenario here, then you would have a score of 0. So this example of a perfect score is in our initial 23-point template. And we have it here just because for you, if you want to access it and you want to try it out, this is kind of, I guess, like a goal that you want to be targeting, that if you're able to reach where you have all ones in all of these locations, then you know you're set and you're good to go. So that's a little bit of an overview of the Kansas City questionnaire and this kind of like a calculator that we filled out. So if you haven't filled it out yet, I highly encourage to please fill it out, or take some time over the weekend to fill it out. It's again 5 minutes long. It's really easy to fill out, and it's fairly straightforward.
Or if you have trouble with computers, find a smart person to help you with right now, or ask us for a PDF. So here's my Kansas City questionnaire. So why don't you, Frank, why don't you just discuss this over here? Why don't you show the questions that we have there?
Yeah, so I mean, this is a great questionnaire. You can see kind of, you can see how with each of these questions, you've basically selected the best option essentially. So this is a questionnaire that's 100 out of 100 essentially, which is really awesome. And this, again, everybody, you should be kind of looking at this as kind of like a target goal or an end goal, because you want to be, again, if you remember, in the 75 to 100 green range that you see over there, you see in the previous scale that we had over there. You mentioned some questions, Dr. Kearney. Are there questions in the chat right now?
So one of the things is that my twin brother, he only scored 52 on his questionnaire. So you can see that it gives you a baseline status to start off with. And I found this actually quite simple. That computer stuff makes my brain sore. I kind of like the paper format, and different ways for doing it for different folks. But we can help you do that too if you want to.
Yeah, of course. So yeah, this would be kind of like a more PDF pen and paper way of doing it, and that's totally fine as well if you want to go with this option. So after you did get your KCCQ results, how do you really kind of interpret it? And one way that I've seen in the literature that, based on research, that people have kind of assigned different classifications to the KCCQ is with an established method of classification by the New York Heart Association. And this classification scheme has four main classes. So you have the first class where NYHA class 1 that you can kind of see associated with the good to excellent range, 75 to 100 in your KCCQ score, where you present with cardiac disease but no symptoms and no limitation in ordinary physical activity. Class 2, you can see appearing in this yellow range here, where there are mild symptoms and slight limitations. Class 3, you can see in this orange range, and there are significant limitations, and there's only comfort when you're at rest. And class 4 is falling under this red 0 to 25 worst range in the KCCQ score, where there are severe limitations and symptoms even while at rest. And you can kind of see this distribution here of the NYHA classes at different regions of the symptom score. So you can see how these kind of match up with the score here on the scale. And another important way you can interpret your KCCQ score is KCCQ change. So if you remember, we had that little sheet here called track your score. And you can go back here and you can see you get to track your score over the different days that you take it. And you can see that if there is a change, there was a recent study that actually kind of correlated that change to different events clinically. And what happens is the score between, if there's no change between 0 to 5, that typically means that you're good. There's no change in your heart failure status. But if there is a change of, let's say, plus or minus 5, that might indicate that there is a small but still clinically important change that has occurred in this questionnaire. However, if you have changes of up to around 15 to 20 and 30 plus, that typically indicates there's a moderate or a large change in the KCCQ. So with changes that are in this large or moderate range, especially if you see that there's deterioration, so your KCCQ is going from like 100 to 80 in 2 weeks, that 100% means that you should be calling your doctor, scheduling a checkup, and really having a professional kind of look at your heart failure status, and hopefully we can prevent it while it's still kind of in the green range from getting any worse through exercise and proper diet and all of these great things that allow us to improve our health. And kind of segueing into that, I think, Adam, you're going to be talking about the machine that we have at the clinic, or the machine that we have that's able to be given to certain patients at the clinic. Adam, if you want to go ahead.
Yeah, so Adam's not able to join at the moment. So in this case, Dr. Kerner, did you want to describe the Cardio Mobile program, or do you want me to go into it?
Sure, we can go that. So one of the things is that what I've learned is that we're asking us to make some changes right now. And one of the neat changes right now is sort of ways of monitoring your health and have some fun. We're in the process of getting something called cardiac mobile device. This is a simple one-lead ECG that they can actually look at your rhythm strip. So this is actually FDA approved for looking for atrial fibrillation, and it's really useful for people who have palpitations and along the ways there. So we're going to actually use it to help motivate ourselves. So I'm asking everybody is that fill out your baseline Kansas City questionnaire, and let's have some fun. So I'm going to ask you for 30 days to think about using 30 Days to Healthier You as our book or one of our programs, and measure your blood pressure for 30 days, measure your weight for 30 days, feed your health versus feed your disease, so make some changes. And 3 times a day, you're going to, before you exercise, you're going to check your heartbeat before and after exercise. And you're going to write all this down in your little book. And anybody who wants to try this is just drop us a little note, let us know in person, or tell us at drkernew@232gmail.com. And then Adam and Daniel are taking keys in this to help us in this circumstance. So again, no one's expecting us to be perfect. Frank wants us to do the Kansas City questionnaire every 2 weeks or so. I'm not going to do it every 2 weeks or so, but I'm going to do it periodically and to see how I feel and how I change and I feel. So I'll give you some objective matters. I'm going to do other things too as well. Next slide, please. So everybody gets to try it for 30 days. Again, we're going to try to encourage people to do something for at least 3 times a day. People say you should do 150 minutes of activity most days. My answer is you should do 60 to 90 minutes of activity most days. We were just talking yesterday, a couple of members of the weight loss crew, and they're walking between 10 and 25,000 steps. I average actually just under 12,000 steps a day over the last year or so. I certainly can do better. I'll keep working about this. So we want you to actually start off with a 6-minute walk test. We want you to read the book 30 Days to a Healthier You. We want you to fill the Kansas City Questionnaire at day 1, at day 30. And we'll have some fun with this and create some little fun competition maybe. Next slide, please. So first is sign up. We'll get you involved, and we want to see if we can improve our scores in congestive heart failure or just in life in general. You don't have to have congestive heart failure to do this questionnaire, because it talks about quality of life as well. It's been validated and people have congestive heart failure, but I think it's useful for many of us to see one number how our health status is between 0 and 100. Next slide, please. So you want to work on improving your scores. And I think the key to success is that for most of us is to try something different, to explore, get your curiosity. Here is Dong, who this we're going to do something with Asian type cuisine, and so I learned about konjac noodles and how to replace certain foods in my diet. So I thank Edie for leading this. So one Sunday, usually the first or second Sunday of a month, we're going to be cooking together for a couple hours. Just on the far right is when we were all together and we got this dragon racing thing we did together. We had 2 teams. We're 2 boats. We came in second on my boat, so and we had fun doing this. And I think for most of us is that what I've learned from the mindfulness group is that we have 40 to 80,000 thoughts that cross our minds most days, and most of them repetitive and most of them unpleasant. And so to acknowledge that, to have fun with yourself and laugh with yourself. And the best way to do that is to laugh with other people. And so let's find ways to enjoy ourselves and also to monitor and take this seriously. Next slide, please. So I think these are key ingredients right now, is that the heart's a muscle. It's designed to exercise. So decide what you want to do and how you want to do this. So I'm asking everybody to consider doing a 6-minute walk test and do it in different ways, different times. But really, once you lose your ability to movement, to exercise, you're in trouble. You'll see other webinars looking into what METs are. If you can function at 5 METs, you can just survive at this point in time. But once you get sick, you won't be able to go home after your hospitalization. If you get a pneumonia, you break your leg, you have bad arthritis, you're in trouble. So action phase activity is one, and Jerry and his team on Wednesdays will either help motivate you and help get you on track, or join the gym, join the YMCA, have your next door neighbor or your friend have our group working with you. Next slide, please. So certainly activity is a crucial part to your success. This is the Action Heart Failure trial. Who's going to be talking about this one? Anybody in particular?
Yeah. So yeah, this was a trial that was done called the HF Action trial, where they actually randomized people into 2 groups, one that just underwent usual care in heart failure, and one that actually had an exercise intervention where they were exercising, doing some mild aerobic exercises, walking, cycling 3 times a week for 36 weeks. And they actually found that this improves your KCCQ score. Of course, improving your KCCQ score is not the only reason you should be exercising. You should be exercising because of all the health benefits that it confers to you. But here in the study, they actually did find, you can see these significant improvements in the KCCQ score. And something I found interesting in the study was, even though it was 36 weeks of activity, you can see that to help you kind of interpret this plot, if we're just focusing on this one here, you can see the group with the dots that are marked in black that represent the exercise training group. And then you can see the group with the dots marked in white that represent the usual care group. And you can see that how at baseline, they all start at around the same KCCQ score. So the KCCQ score is represented here on this y-axis. And you can see that over time, which is represented by this axis here, you can see that the exercise training group started having a higher KCCQ score compared to the usual care group. And what I found really interesting is even at just 3 months, you can see a marked improvement in the KCCQ score, which indicates a better quality of life. So this could be a really great way, and honestly, a really quick way. 3 months is not a lot of time to improve your KCCQ score and improve your quality of life. And you can see that even though that the trial lasted for 36 weeks, the follow-up lasted all the way to 36 months. And this is 3 years. So in 9 months of exercise, consistent exercise, 3 times a week, exercising, doing aerobic, walking, cycling, hiking, you can see that there's a consistent maintenance of this improved KCCQ score. And whether that's because the patients were inspired, they really liked how the quality of life changed, I'm not too sure, but it's really interesting to me that you can see this improvement being consistent and staying here. And you can see here on this plot here as well, the frequency of the amount of patients with an improvement of a KCCQ score increased compared in the exercise group compared to just the normal control usual care group. So it's really interesting results that I think really speak to the power of exercise and how it can improve your quality of life and improve your KCCQ score if you're looking to do that.
So it's quite interesting, Frank, that people started off with a score around 67, and that by giving people advice in the usual care, they got better. But if you now gave people advice and gave them support, then you got even better. So it doesn't mean you can't do it on your own. It just says for most of us is having some supports and doing it together makes a bigger difference. So I think it's actually important because heart failure wants to get worse over time. So by adding activity, one of the action phases today is that you make an impact. Now, once you have significant congestive heart failure, I'm not sure you're going to live a whole lot longer, but you're certainly going to live a whole lot better. And and that's important. Quality of life is really, really important. And many people with congestive heart failure, that roller coaster ride can be very upsetting and hard to deal with. But adding activity to that just makes that takes the bumps out of the roller coaster and makes things a lot more smoother and better for all of us. Thank you.
Awesome. So yeah, in terms of just some exercises, if you do want to get active and you're inspired to take on some exercising, there are a lot of great exercises to try, but there are certain exercises that you want to maybe be avoiding. So for example, anything high resistance training, like if you've been watching the Olympics, powerlifting, maybe avoid that for now. As well as any static or isometric exercises like planks or push-ups, maybe avoid those as well. And I think to really work out your heart, a great way you could do it is just simple stretching, light aerobic activity, walking, swimming, cycling, or even scheduling maybe like a hike, going with your family or your friends. And that's a really great, fun way for you to go outside and get some exercise. And another great way that we want to talk about is the 6-minute walk test. And I'm sure you've heard of it mentioned a little bit here and maybe in other places. I think we've mentioned it in previous webinars a little bit as well. And I just want to talk about this test here, which is kind of another measure of heart failure, but it's ultimately really a measure of your aerobic fitness and how healthy your heart is in terms of allowing you to walk. And the test here it's very simple. So it's essentially you have a 30-meter, you place 2 objects 30 meters apart from each other, and you set a timer for 6 minutes, and you just measure how far you are able to walk in that 6 minutes. So I have a graph here of kind of the normal values of around what you should be aiming for. And in this report, they reported that if you're under 40 years of age, you should be averaging around 736 meters per every 6 minutes. If you're around 40 to 50 years of age, it's around 700, and it gradually decreases as you get older, which makes sense. So you should be aiming for around this area, around 550 to 750, depending on how old or young you are, to maintain kind of like a healthy aerobic fitness that has been shown. If you remember from that study that we had a couple slides back that compared the KCCQ score to the 6-minute walk score, it's the second best. It's the second best predictor for heart failure. So it can still be a really great way for you to monitor your heart failure as well. And it has the added benefit of you getting a little bit of aerobic exercise in. And if you're looking for other resources and other support, as Dr. Kearney mentioned, which can really help improve your heart failure as well as helping you exercise, we do have some other videos up on the YouTube channel, one on feeling unmotivated, let's jump into exercise, one on some really great dynamic warm-up and cool-down stretches, and one for chair exercises that you can do from home. So if you're working at your desk a lot like I am, you can kind of take maybe 5 or 15 minutes out of your day to kind of just take a break and do some stretching, do some exercises, and these are really simple ones that you can do from your home. And finally, I just want to share some different apps that you can use to kind of track your exercise. So you have Strava, which is a really great app that is kind of like a social media almost, where you're able to post and share your walks with the friends that you have on Strava. And what you can do here, you can see if you press this button called record, you can actually toggle if you're walking, if you're running, what you're doing, and you can just press start and it'll track how fast you're walking, how much you've walked, how long it took you to walk, and it'll keep this track in here on your home page where you kind of have a log of how much you've been walking, how much you've been running, and you can see summary statistics and everything like that. So Strava is really great. I really like the app myself. And then you also have an app called MyFitnessPal, and we've talked a lot about diet today. And MyFitnessPal is really great for you to be able to track the caloric intake that you take in terms of the food that you're eating. And it's really simple to use. You can input it, you can scan barcodes, and it'll instantly input the amount of calories and the amount of fats and the amount of carbs that are in whatever food you're intaking. And it also has the added benefit of you being able to track your exercise and your weight. So it's a really nice one-stop shop for a lot of tracking in terms of health and lifestyle. And the final thing that I want to discuss is about depressive symptoms in HF. So 100%, I think depressive symptoms are important for managing heart failure, but you should be also really focusing on your diet, and you should 100% really be focusing on getting a lot of exercise. But in studies, they have shown that depression is associated with heart failure. And you can see on this image here on your left, the NYHA functional class 1. So as we mentioned before, you can see that 1 was the least amount of symptoms for heart failures. And you can see it's only a 10% depression rate. Whereas in class 4, you have a 42% depression rate. And in another meta-analysis, which if you remember from what Stuart was talking about, meta-analysis is a really great, a strong way to measure associations that have been coming from a lot of different researchers. And you can see that all of these really kind of show that there is a risk. So all of these are over 1. And you can see that any scores over 1 really have kind of like a 2 times, 2.7 time, 3.3 times association between depression and heart failure. So it is also really important to kind of try to manage your mental health as well. And a great way you can do that are apps. For example, Headspace is a really great app where you're able to kind of listen to guided meditations, sleep podcasts, and track a lot of these things like mindfulness that you can employ in your day-to-day life that allow you to really take advantage and be aware and slow down your thought process, slow down your thinking, and be in a better mind or headspace to allow you to kind of manage the symptoms of heart failure that you have. And in fact, what you can actually do to help improve your mental state is exercise. Exercising can actually improve your mental state because it confers so many benefits. Like, for example, if you're walking out in nature, nature can really help improve your mental health as well. So there are a lot of really great ways to improve your mental health on this app, and I highly recommend that you check it out. So we're nearing the end of our presentation, and this quote I saw in actually a previous webinar I thought was really interesting and might kind of apply here. Knowing is not enough, we must apply. Willing is not enough, we must do. Where it's really reiterating what we wanted to say about taking action and having that call to action, because all of this and knowing about all of this is great. But to really make market improvements in quality of life and improve that Kansas City score and prevent heart failure, we must take action and do exercise and regularly look at our diet and caloric intake, and also track our mental health. So these are really important things that we must be doing as well. And finally, just to summarize our presentation, our webinar today, it's important to know that CHF progression is insidious. It can sneak up on you because there are no symptoms or signs initially, and it's really important to monitor and track. You should also know that there's this great form called the KCCQ form that allows you to manage your heart failure status. And finally, if you want to improve your heart failure condition, or in general just stay healthier in life, exercise, mental health, and diet are really great at protecting against CHF. And I guess with that, that's our presentation today. Thank you so much for coming out and listening. And if you have any questions, we'd welcome it.
Well, I want to thank Mustafa, Frank, and everybody else for putting all this together. I certainly learned a lot. I think, we have some choices, and heart failure can sneak up on you. But remember is that it's your body gets wear and tear as time goes on. So I think what I'm trying to do is that during the pandemic, it's been hard for many of us to lose weight. There'll always be the next excuse tomorrow, but I managed to lose about 20 pounds. I gained back 7, so I just had my apple right now, Stuart, and I'll always struggle, but I'm always going to be hungry, but I'm trying to apply all the things that people talk about. Right now, Frank, is that my score is at 100. How long it will stay for 100, I don't know. But I do know is that it's a lot of hard work to be healthy, and that I see too many people not give the fight that they deserve to give themselves. And sometimes I'm not sure why, but let's do it together, and today's a new beginning. You can see in the trial that you look at heart failure, they start at 67, they move that upwards, and you can decide how you want to do. So the action phases, number 1 is to start from the baseline, get your score, find out your Kansas City questionnaire. Is it 10, 20, 30, 60, 80, 100, whatever it is, and then take some steps. If you want to do it on your own, by all means, that's very reasonable. You want to do it with your entourage, your family, that's wonderful too as well. I need a bigger team to make myself better. And I like what we're doing right now with the cardiac device and the monitoring for trying something for 30 days to help you. I found that the webinars from the weight management one and the mindfulness one and the cooking one, terrific. The videos we have some long ones and short ones. Helps is not simple. It's not a 2-minute discussion. What you'll find is in clinics, we're just going to make sure you're okay, make sure your pills are okay, you're on the right therapies. But to really expand your knowledge of health is going to require a total collaboration. So here's one example, and this is actually a very actionable phase right now. And more importantly, your quality of life gets better, because unfortunately I've seen too many people where it's getting more difficult towards the end of their life. And you mentioned if you're in your classification 4, that means your Kansas City questionnaire is probably around 25. At least half of those people are depressed at this point in time. Good reason to be depressed. And the fitter you get, the happier you are. And I bet if people lose 20 pounds, their Kansas City questionnaire will go up by about at least 30 points or so. And I'm always going to be attentive to my blood pressure and to my cholesterol, the risk factors. These are things within my control with lifestyle changes and appropriate medications. So terrific. I have all the technology to measure. I can tell you if you have structural heart disease. I can tell you if you're developing congestive heart failure. And I can say that right now looks like congestive heart failure is growing. Couple of good reasons why. We're living longer. We're not dying from our heart attacks. We're not dying from our strokes, but our heart muscle and the rest of the body are getting tired, so we can train that better. Stuart, are there any questions or comments from anybody?
Not at this time. It looks like everybody is happy with the material. And if anybody does have any questions after the webinar today, we encourage you to just send us an email. The email's on the screen there, and we'll definitely get back to you as soon as we can with some answers.
So if people want a PDF of this Kansas City questionnaire, we'll post that. We'll get that to you. If people want to try our 3 days monitoring with the cardiac device, we're up to 20 devices, and I hope to go up to 40 to 50 of these devices. So everybody should get a try for it for 30 days. So let us know if that's something you want to try as well. Why don't you have fun and enjoy yourself? Don't be hard on yourself. Be hard on yourself if you don't try, and if you try, terrific. And this is try your curiosity. Try new things. This is something new for us too as well. So it all started off when I heard a lecture on this in our during cardiology rounds, and this is going to be a new approach for us. We're also doing some clinical trials. The question. I remind you that people who are enrolled in clinical trials usually live longer compared to people who are not in clinical trials. But applying what we learned from clinical trials to everyday practice is actually so important as well. So wonderful discussion. Stuart, I'll give you the last word, or if any other speakers want any final comments by anybody else at all. I think it's wonderful. Thank you.
Yeah, thanks everybody for putting this together. I just want to remind anyone who's joining us on WebEx or YouTube that we've also put together a short summary package as well with some of the most important details we discussed. So if you ever want to come back to this information and you prefer to read it rather than listen to it, you can find that in the description of this video. It's 2 pages and you'll be able to print it out, take pictures of it, write it down, make some notes, whatever's best for you. This videos also stay up on YouTube, so they're always going to be there. You're more than welcome to come back to it at any time, whether you're up at 2 o'clock in the morning, like Dr. Kernew is, or it's the first thing you want to watch when you wake up. And I just wanted to thank everyone again for joining. I want to thank the team of volunteers for putting this presentation together, for being flexible with some of the last minute additions that we've all made. And I just wanted to, again, encourage everybody to take some of these actionable items that we discussed today. I think it's not lost on us that if you're spending your Fridays with us, focusing on your health, it means that you're probably an Olympic athlete in your past life, and it's great to have you here, and we look forward to seeing you sometime next week as well.
Good night, everyone.
Take care, everyone. Have a good night.